Yes, Sharath, you are going for CAPF. First, tell me about CAPF.
So CAPF actually it's an Central Armed Police Force, whereas before the name was paramilitary, and it was taken into a term called CAPF, whereas it is categorized into three. One is for internal security, second is for national security, and third thing is for industrial security. For internal security, they falls under SSB, ITBP, and Assam Rifles. Whereas for industrial security, these falls for CISF and CRPF. For border security, for border guarding forces will be BSF, SSB, ITBP, and Assam Rifles. Whereas SSB borders for Nepal and Bhutan, whereas ITBP borders for Indo-Tibetan borders, and Assam borders for Bangladesh and BSF as well.
ITBP was founded on?
So ITBP, sorry sir, I'm not aware of.
24th October 1962. Okay. NSG was formed on 1986, SSB 1963, CISF 10th March.
Okay.
And CRPF 27th July 1939, and BSF founded on 1st December 1965. Okay, my next question to you is, like, what motivates you to come towards CAPF?
So motivation, there is from my past, from my childhood, as I have seen my father. Basically, my father was an sub-inspector of police in the civil in my district, Andhra Pradesh state. As I have seen from him from past 25 years, as I developed his braveness, as I seen the work commitment and the genuinity with him, that makes me to push up into this CAPF. As I'm very hard working person, as my yes sir.
Okay. What do you think the qualities a CAPF doctor must have, according to you?
The quality should have like the CAPF doctor should be moved across the country. For that, firstly, he need to adapt the climatic conditions, and he need to aware of the emergency treatment protocols. And he need to, if possible, he need to trek the mountains to look after the lower community people who were living in the tribal areas. Yeah, like that.
Okay, now you tell me, like during your MBBS, which was your favorite subject and why?
So my favorite subject is community medicine, sir.
Why community is your favorite?
Because in my childhood, in my tribal village, in my native village, many of the people were suffering from elephantiasis, sickle cell anemia, and my own brother was suffering from nyctalopia, which is called night blindness, which it was saddened me very deep. So why can't I learn what the things were happening in this medical field? So I chose to become a doctor, and chose my favorite subject as community medicine.
What type of emergencies you have handled? What type of patients you have seen?
So during my internship, I have seen AV malformation in the brain, like general cases like dengue, typhoid, fevers. MI cases. Yeah, as of for internship things, I have seen these cases, sir, in general.
See, you have opted yourself to be a doctor, and later on you are coming in CAPF. So if your ultimate aim was to go in police, then why not early? You can go directly in the police also.
So I can, but things are not different in my life because uh, my childhood changed the path into a doctor, and after that, as an adult now, my path changed into into the CAPF profile because uh, as my dad serving in the state level, so that I need to serve in the central level if if I get opportunity.
Today I have given you medical portion. So all these medical topics are quite lot many topics are there. So how many days you feel that you need to prepare all these topics according to you? How many days you need?
According to me, I would like to have 3 to 4 days to
Within 3
prepare for
days,
this term.
3 to 4 days, you will cover all this 500,
Yes, sir. Because
200,
yeah, because
more than 300,
these were
400.
studied before.
Very good.
Just a recall. That's it, sir.
Yes, yes, yes. So I suggest you that you should go with these topics as early as possible. The mock session we will take again of yours with medical as well as professional personal question answers.
Okay, sir.
Right? It will help us a lot. Okay, what are
Okay,
your
sir.
strong points, your strengths?
So my strengths will be like I can adapt to every climatic conditions, and my friends call me versatile because of my adjustable nature. Uh, I'm very systematic and dedicated person, so that I can work at any environment with any type of stress.
Now, one interesting question from our side. How you find the
Okay.
test we take prior giving you medical portion? I took one interview of yours and I challenged no doctor till yet has achieved 50% marks in my interview. That is personal interview between you and me. So how you find that interview?
So it was good.
Totally medical. It was totally medical.
It was, this is what I'm saying, sir. Regarding the medical portion, because no any human being can recall all those 12 subjects in 1 a day, or
I agree with
like
you.
in 1 hour. Yeah, everyone has its own limit knowledge. They can recall 5 subjects in 1 hour. Few people can recall in 30 minutes, because to their age it matters, according to the age and their how many times they revision the subjects. I mean, how they recalled during their examinations, and this how depends upon the medical portion, if any doctor is going to answer the things.
But Dr. Sharad, this is an excuse. I want how you find the questions.
Finding questions for I chose
My
sir, I
questions
can't
were
hear, sir.
genuine. Good questions, I think. There was
Yes, sir.
nothing
Yes, sir.
out of the syllabus or something like that.
But even though this all were simple questions, but
Yes.
uh, as I but during my MBBS, if I am an immediate MBBS graduate, yes, I would be answering the things what you asked. But after MBBS, I did my PG in epidemiology.
Right.
There is a complete difference. There is clinical, non-clinical. I feel that it would be the reason that not to recall the questions which you asked.
Right. I appreciate many of the answers you answered also. It's not that you didn't answer. But few questions really we take it very light and we think, yeah, we will cover it. But when I ask that time, it. Now my next
Yes, sir.
thing
Yes.
to you is, like you did your PC. So tell your about PC. Like you did it from where and what part you learn. Why it was important for you like this?
So I did my postgraduate education. It's a master's degree in public health. In short, we used to call as MPH. I did in the field of epidemiology, where it's complete difference from clinical. Basically, epidemiology deals with more kind of research activities, some kind of analysis of what would be the disease burden in the country, or what would be the female the rate, the death rate, or the mortality rate from this disease. What is the mortality rate from this disease? We actually deal in this type of genre, especially with epidemiology. And compared to India and Kyrgyzstan, where I did my masters, whereas in India we have MD community medicine, whereas in Kyrgyzstan we have MPH. Even though now in India it's new emerging rather than MD community medicine, but anyhow MD community medicine is it has a strong base rather compared to MPH.
So your education, especially your post-graduation knowledge, how it will be helpful to your CAPF job?
Sir, my postgraduate education knowledge, I can say in aspects of like if I got posted in completely northeast states, there the dengue protocol is completely different. The malaria protocol is completely different. Whereas if you come for the south states, the treatment protocol for malaria is different. Whereas in northeastern state like Assam and Meghalaya, Mizoram, we used to give like artesunate and artesunate treatment. Whereas in south we used to give with antibiotics. Like it changes from region to region. Whereas especially in vector-borne diseases, yes, but in the urban areas, the people know how to behave, how to educate themselves. But in tribal communities, as me or any educated person need to have that we need to educate them regarding the health, regarding the education, regarding the hygiene process and all. So I feel I may help in the CAPF and as well.
Recently, when AMC interview was conducted, at the last of the interviews time period or last few days, they asked most of the questions from community on.
Okay.
And one personal question, how you felt with us, PD classes, how you felt with us, what changes you find with these days?
Yes, this is important thing to say because before I was nothing. I mean, regarding the interview aspects, I was nothing. I don't know how to build myself, like personality, skills, how to be in the proper way regarding the interview selection. I mean, interview process and all. After listening to your classes, you really made me to change. You boosted my confidence. You changed my personality skills and all. I am really thankful for you, sir. Yeah.
It is my duty. Yeah.
Okay. Yes, sir. Yes, of course.
See, Dr. Sharad, now what is happening? See, we'll complete our 7 days. And if you want that, sir, I have prepared my medical topics in these many days. As you stated just now, sir, I can complete within 5 days, within 4 days, 3 days, I can complete. But I know that you need time. I know personally. It looks as if very easy, but when you go through my topics, you will find, sir, it's a big list and you have to prepare well.
Okay.
So I suggest that you should give demo interview to me, practice mock with me. Again, when you prepared well, we will make again. And when your interview date will come or will be near, I will take again your mock. Like you are one who joined early, I always try them to give more. So because I have time and interview, it takes hardly 10-15 minutes to take interview. Within 15 minutes, we can ask lot many questions. So that practice will help you now. So next mock will be through body language. I'll check all your body language. I have given medical portion, so I'll check all medical topics also. As many I can. Okay. So date you will decide, time I will decide for you. Okay.
Okay, sir.
Whenever you feel, sir, I want to give more, but still I think personal questions are pending.
Yes, sir. Yes.
So we'll
Yeah,
cover
yeah.
first of all the personal questions, then we'll go with the mock sessions. Okay. And it's your choice. Whenever you want, after week, fortnight, whenever you feel free, you can intimate us as per our schedule. We will take a dynamic interview. And I have seen
Sure, sir.
good change, really. That's why I asked this question from you, how you felt.
Thank you.
Really,
Thank you.
the
Thank
very
you.
first day and now there is a big difference. Even you can ask from your family members. If anybody taking your interview, you can ask that what changes you. They'll suddenly say that changes are there, ultimate changes. So
Thank you.
it's
Thank
good.
you, sir.
But I also appreciate one thing in you, that you participated it wholeheartedly. Regarding
Yes, sir.
CAPF, regarding this particular, regarding all the aspects, not only this medical portion or even body language, even professional questions, even the first day introduction, you are very dedicated. I told you to send me introduction till 10 p.m. You send me within 6. So, which shows that you are very dedicated. Some questions
Yes,
I
thank
told
you.
you
Thank
do it yourself. No need to send me. I know you will, but still you practice and you show me, sir, please check. So these things shows your dedication. So I
you. Thank you,
appreciate
sir.
this thing. Okay.
My pleasure.
Tomorrow is your night duty.
So actually, yesterday it should be, sir, but it was cancelled. My
You.
senior doctor said that we need to come after Dasara festival.
Okay. So we will cover personal questions by tomorrow itself.
Okay, then, sir. Okay.
You are free, so we'll cover. Okay.
Yeah, definitely, sir. Definitely.
Okay, we'll cover personal questions. Then we will do one thing. We will take such mocks again and again as per your convenience. And we'll cover all the things. But
Okay, sir.
when your into will be there, I'll give you one interesting thing. That is our Brahmastra, which you don't know about it. If you find some changes in
Okay.
you, it is good. But I promise you, when you will get Brahmastra, you will find a drastic change in your personality. I promise. Whomsoever I have given yet,
Okay.
till yet, everybody has appreciated and told me, sir, really your Brahmastra is ultimate. So if you are finding change, it is good. But still, picture abhi baki hai. That part will change your personality more.
Definitely, sir.
Okay.
Looking forward.
So we'll go with Brahmastra, but first I want complete development in you. That will go with the mock sessions that I've done. Okay, tomorrow we'll meet again.
Definitely.
Enjoy.
Definitely. Definitely.
Bye
Thank you,
bye.
sir. Have a good day.